Welcome back to the Wellness Cues, where we bring you powerful tips to help you live healthier and longer. Let's get right into it. Your liver is one of the most hardworking organs in your body, and yet, it's often one of the most neglected. It processes toxins, supports digestion, balances hormones, regulates blood sugar, and helps you fight off infections. Despite all of this, most people don't realize when their liver is under extreme stress. This is because liver damage can progress silently for years before showing obvious symptoms. By the time you notice something is wrong, it may already be in a dangerous stage. That's why recognizing the early toxic warning signs is crucial for protecting your health and preventing irreversible damage. Today, we're uncovering the top 5 signs your liver is screaming for help and why ignoring them can put your life at serious risk. Number 1. Persistent fatigue that doesn't go away. Feeling tired after a long day is normal, but if you find yourself constantly exhausted no matter how much rest you get, your liver could be to blame. The liver plays a major role in converting food into usable energy. When it's overloaded with toxins or damaged, it struggles to break down nutrients efficiently, leaving your body in an energy deficit. This can lead to a deep, bone-tired fatigue that doesn't improve with sleep or coffee. Another reason fatigue sets in is because of a buildup of waste products in the blood. If your liver isn't filtering out toxins properly, they circulate through your body, causing inflammation and slowing down your brain and muscles. You might also notice brain fog, difficulty focusing, and a general feeling of heaviness. Many people mistake this for stress or aging. But if your tiredness is paired with other symptoms on this list, it's time to take it seriously. Persistent fatigue is one of the earliest and most overlooked signs of liver distress. Ignoring it could allow damage to progress silently until more severe complications develop, such as cirrhosis or liver failure. Number 2. Yellowing of the skin and eyes. Jaundice. If you ever notice your skin or the whites of your eyes turning yellow, you should seek medical attention immediately. This condition, known as jaundice, is a clear sign that your liver is struggling to process bilirubin, a yellow pigment produced when red blood cells break down. A healthy liver filters out bilirubin and sends it to be eliminated through bile. However, when the liver is damaged, bilirubin starts to build up in your bloodstream, leading to the yellow discoloration. This warning sign can appear gradually or suddenly, depending on the severity of the liver problem. In some cases, jaundice is accompanied by dark urine and pale clay-colored stools, which also point to issues with bile production and flow. Jaundice can be triggered by hepatitis, liver inflammation, bile duct blockage, or advanced liver disease. This is not something to wait and see if it goes away on its own. It's a red flag that your liver is under extreme distress and needs immediate medical evaluation. Number 3. Abdominal pain and swelling. The liver sits in the upper right portion of your abdomen, just beneath your ribcage. When it becomes inflamed or enlarged due to toxic overload, you might feel discomfort or pain in that area. Some people describe it as a dull ache, while others experience a sharp, stabbing sensation that worsens when they move, cough, or breathe deeply. Along with pain, you might notice your belly appearing swollen or distended, even if you haven't gained weight. This can be due to fluid buildup in the abdominal cavity, a condition known as ascites, which often occurs in advanced liver disease. Ascites develops when liver damage leads to high blood pressure in the veins around the liver, portal hypertension, and a drop in the production of albumin, a protein that helps keep fluid in your bloodstream. The excess fluid seeps into your abdomen, causing bloating and discomfort. While mild swelling can be mistaken for bloating from diet, persistent abdominal distension combined with pain is a serious sign that your liver may be in trouble and needs urgent medical attention. Number 4. Easy bruising and bleeding. If you notice you're bruising more easily than before or experiencing frequent nosebleeds, your liver health could be at risk. The liver is responsible for producing proteins that help your blood clot. When it's damaged, these clotting factors decrease, making you more prone to bleeding and bruising, even from minor bumps or cuts. This can be one of the more subtle warning signs because many people dismiss small bruises as accidents they don't remember. However, if you see unusual patterns of bruising, bleeding gums, or small red or purple spots on your skin, known as petechiae, it's time to take a closer look. Easy bruising may also be linked to a shortage of platelets. which can happen when liver damage leads to an enlarged spleen that traps and destroys them. Left unchecked, this can progress into severe bleeding disorders, which become harder to treat as liver function declines. If your skin is showing signs of fragile blood vessels and your injuries take longer to heal, this is your body waving a big warning flag that your liver is struggling. Number 5. Changes in mental function. Hepatic encephalopathy. One of the most alarming signs of advanced liver distress is when it begins to affect your brain. This happens in a condition called hepatic encephalopathy, where toxins like ammonia build up in your bloodstream because the liver can no longer filter them effectively. These toxins eventually reach the brain, leading to changes in mood, personality, and mental clarity. At first, you may notice mild symptoms such as irritability, forgetfulness, or difficulty concentrating. As the condition progresses, it can cause confusion, disorientation, slurred speech, and even tremors in your hands. In severe cases, it can lead to unconsciousness or coma. Many people mistake early signs of hepatic encephalopathy for stress, anxiety, or depression, but the underlying cause is much more dangerous. If you or someone you know is experiencing sudden mental changes, especially along with other liver-related symptoms, this is a medical emergency that requires immediate intervention. The sooner it's addressed, the better the chances of preventing permanent brain damage and restoring liver function. Recognizing these 5 toxic warning signs can save your life, but prevention is even better than treatment. Your liver is resilient and capable of regenerating itself if damage is caught early and the root cause is removed. Maintaining a healthy weight, avoiding excessive alcohol, limiting processed foods, and protecting yourself from hepatitis viruses are some of the best ways to safeguard your liver. Drinking plenty of water, eating a diet rich in antioxidants and fiber, and getting regular checkups can also help your liver perform at its best. If you notice any of these symptoms, persistent fatigue, jaundice, abdominal pain and swelling, easy bruising, or mental changes, don't wait. Seek medical advice as soon as possible. A simple blood test can measure your liver enzyme levels and indicate whether further testing is needed. Remember, your liver may be quiet, but when it starts sending you warning signals, you must listen. Ignoring these signs can lead to irreversible damage, chronic illness, or even death. Your liver is not just another organ. It's your body's detox, powerhouse, energy regulator, and metabolic control center. Taking care of it isn't optional. It's essential for your survival and quality of life. Don't wait until your liver is screaming for help. Be proactive. Listen to your body and give your liver the care it deserves. Thanks for watching The Wellness Cues. Your health is your greatest investment. Take care of your body. Listen to its warning signs, and it will reward you with strength, energy, and a longer, happier life. Stay healthy, stay informed, and make sure you like, subscribe, and share this video with everyone you know. I'll see you in the next video.